Okay, so we are streaming to YouTube. Okay, so we are streaming to YouTube. Good day, and thank you for joining. I'm Sherilyn Francis, and on behalf of the Morehouse School of Medicine Prevention Research Center, we welcome you to part 5 of the Family Strong 20 virtual meeting series. Additionally, we invite you to connect with us via your favorite social media platform using hashtag FamStrong20. The mission of the MSM PRC is to advance scientific knowledge in the field of prevention in African American and other minority communities, and to disseminate new information and strategies of prevention. The MSM Prevention Research Center strongly holds to the applied definition of community-based research, which is dynamic, prioritizes community and research entity partnerships, is focused on prevention, is tailor-made, is ethnically and culturally focused, and prioritizes health policy to advance health equity. I now present to you today's session entitled Our Advocacy, the Political Determinants of Health, presented by Dr. Maisha Standifer and Dr. Rashad Ritchie. And we will begin with Dr. Standifer.
Okay, good afternoon, everyone. I am so excited to be here. I'm currently at Morehouse School of Medicine, serving as the Health Policy Director in the Satcher Health Leadership Institute. Again, I'm excited to be here to talk a little bit about the political determinants of health. It cannot be captured, of course, within the few moments that I'll talk today, but it's an introduction and an elaboration, and I continue to engage with community partners, with community organizations, academics, and multi-sectoral particular participants. And so again, I thank you for being involved today. And so I ask that you hold your questions toward the end of my presentations and at the end of this particular session. But I would like to start off with a video that was created by our current executive director in Satcher Health Leadership, Daniel Dawes. And Daniel Dawes has basically, we're talking about our advocacy, has published a book, The Political Determinants of Health. And so we're looking at the political determinants of health, we often call PDOH, and we're looking at, again, social determinants of health, health equity through the policy lens. And so again, I'll talk a little bit after the viewing of the video. Thank you.
We know there's been this larger movement to increase healthcare access, to improve quality. But underneath that movement has been a group of folks who have committed to really pushing the boundaries, making sure that we widen the safety net, stretch the umbrella a bit to include as many individuals as we surely can. A lot of people, when they hear me say, when they hear that I've written this book called 150 Years of Obamacare, they go immediately to, oh, 150 years? But that's not the case. We have been trying to push our health equity agenda for over 225 years. And no matter how hard these health equity champions tried to reinsert that language, to get it over the passage, to get it passed, they just couldn't succeed. And so, thankfully, President Abraham Lincoln's folks, although he died, he was assassinated a few weeks after that bill was signed into law. His folks decided, well, you know what? We believe we have the authority to establish hospitals to increase access based on the language in that bill. So even though it wasn't explicitly included, they found a way to get around it. So after that, though, here's the clicker. So we didn't get mental health reform signed into law. We get this comprehensive health reform, this, like all the social determinants of health law signed. But that only lasted 7 years.
Joining us now is Daniel Dawes. He is the author of The Political Determinants of Health. And Daniel, thanks for being with us. First of all, one of the things that I found interesting is that your book deals with the fact that these determinants not only affect our health, they affect our lifespan.
That's right, absolutely. So, we've long been talking about inequities in this country, and many folks think that, these racial disparities that we see today just suddenly appeared. And that's really not the truth. They have been with us for over 400 years. And yet from the research, we've gotten closer to understanding what is driving these inequities in our society, right? And a lot of folks will talk about the social determinants. These are your structural conditions in which we're born, in which we live, we pray, we work, and they have about a 40% impact on our lifespans. So what I have done is to say, wait a second, underlying each of these social determinants, so these are whether you have safe and secure housing, do you have transportation to get to work or to get to your school or get healthcare services? Do you actually, are you able to access a grocery store that offers fresh fruits and vegetables? These are what we call the social determinants of health. But undergirding every single one of these social determinants is a political determinant of health. These are the main instigators impacting us. So when we look today at what is happening in America, when folks have seen now for the first time the magnification of health, right?
I think the phrase
So,
renewal.
I'm sorry?
Yeah, the phrase was urban renewal.
Urban renewal, thank you, that's right. And so when you look back at what caused this urban renewal, it's a political determinant. And today we see higher rates of asthma, for instance, in Harlem, New York. And what research has shown is because of bus depots that were located there in Manhattan. 6 of the 7 bus depots in Manhattan were placed in the Black community. If you go again into many of these other communities, it was a Highway Act, a federal policy that created these types of infrastructure. The Urban Renewal Program with the Housing Act created the decimation of housing for hundreds of thousands of African Americans. And this was under, Franklin Delano Roosevelt, under Harry Truman, as well as Republican policymakers throughout our decades.
Because those people didn't like Black folk, or did it happen because pretty much politics discriminates against poor people?
Well, what they will argue, we know that there have been facially discriminatory laws in this country, but they were intentionally designed to redline and to discriminate against communities of color. But as we moved into the early 90s, or actually in the mid 90s, you saw folks moving towards more facially neutral laws, right? That weren't intentionally discriminatory on their face, but had a discriminatory impact. So it's debatable on whether it's truly intentional. I would argue that that is the case. If you look at Social Security, for instance, the NAACP had railed against the intentional omission of African Americans in terms of domestic workers and agricultural workers, 90% of which would have pushed out the Black population from receiving benefits. So it's debatable, I think, whether it's really intentional or it's just having a discriminatory impact. I actually lean on the side that there probably is more intentionality there than there is a discriminatory impact.
Daniel, we're going to take a break. When we come back, I want to talk about how do we go forward? What do we do to fix this problem? Because it is an interesting dynamic in a lot of neighborhoods, jobs versus poor health. So that's right.
Thank you so much. And again, it's just an introduction with a video by our current executive director, but just to highlight the current climate, right, of the political determinants of health. I believe someone wanted to ask, well, what's going on with the current climate, with the current election, with both parties and their platforms? Well, we know what we're doing here at Morehouse School of Medicine. As I mentioned, our current executive director has published a book, The Political Determinants of Health, but he's also published a book about the Obamacare Act and the Affordable Care Act and what it has done for communities of color, particularly focusing on medical vulnerable communities. And so we're looking at, African-American, again, not just African-American, we talk about people of color, but we're talking about indigenous populations, those populations that are often not heard or seen. So again, those who we don't often hear from and even know about, but we know that they're suffering, of course, a disproportionate amount of disparate outcomes that we see in our healthcare system. And so we want to talk about that, where Daniel talks about the Obamacare. 150 years prior to that particular legislation coming out, there has been work in health equity from, dating way back to the 1800s. There has been work to try and overcome some of those political and social drivers that basically we see today over generations. And so when we talk about generational health outcomes, we know that that is a part due to policy making and policy implementation. And so when we want to talk about also environmental justice, I can talk a little bit about Obamacare and some of the actions that we're doing at SHLI. We're talking about environmental justice, particularly focusing on climate change and its effects on communities of color and disproportionate amount of health outcomes within these populations. We know environmental justice and that whole arena has far long been established, definitely within the Atlanta community, working here for over 25 years in that particular arena. But we know that, we know that it has a grassroots evidence-based coalition that's been fairly great in terms of pushing the topic forward. But what are people actually doing in legislation and up on the Hill? And so we know that we have to be heard, understood, and then lead to a actual bill. And so that's what we're doing here at SHLI. We're working on environmental justice, climate change for vulnerable communities. We're convening a upcoming roundtable to talk about some of these particular drivers. When we're talking about the political determinants of health and that lens, we're looking at COVID-19, especially with this particular policy lens. We're looking at technical assistance, data, and missing data. What is the missing data talking and what is it saying about our vulnerable communities? Again, we know that this is very prevalent when we're looking at the higher rates of the virus being in communities of color. And so we're looking at, pharmaceutical companies. We have an initiative with Gilead. We have really a great initiative focusing on translational health outcomes, particularly focused on bench science, behavioral, mental health, focusing on medical cannabis within 65 older and populations and the health disparities and health equity. So we know that we have a lot that's going on, but we're looking at it through a political determinants of health lens. This has this basically where we are now, the health outcomes. Again, we know that social determinants of health, they've been around, and we need to understand the foundation often caused by policies that have been established and policymakers that may not listen quite to the academicians or even some of their fellow policymakers. But we are making strides toward making it heard up in the Hill, and that's when we have to know and we have to get out there and be heard at the polls and definitely let them know that we're here. So if we have any additional questions, please let me know.
Absolutely. I have a question for you. So thank you so much, Dr. Standifer. How do we, as members of communities, advocate for the change that we want to see and inform policy?
Yes, can you repeat that question?
Absolutely. So actually, Dr. Akintobi
Oh,
summarized
yeah.
it perfectly.
Okay, yes.
So what can communities do to be politically engaged in the next few months?
So this is great. Thank you, Dr. Akintobi. This is great because I think that's what people are asking. What can we do? We know that, those voting initiatives and volunteerism on certain campaigns, but we also have to make sure that we're heard and engaged in the right direction, right? So we don't want any particular political party to take our voice, our work, and our vote for granted, right? We have to be heard. So go, not just people talk about to the polls, but go and be heard and engage yourself, not just in some of the political organizations that are there, but join forces with existing community organizations. Morehouse, definitely, we have connections with community partners that we have and local organizations, and we can provide more information. But it's definitely, number one, to be politically engaged in some sort of fashion. And we don't think that we can be because we're, little local community in Atlanta, but we have community-based organizations, as I talked about. We have statewide legislators that would love to hear your voice. So even if we're talking about writing a letter to your local representative, being engaged in, well, someone asked me, a recent parent of a child in my school asked, how can I be politically engaged? Go to your school board. And those are things to have your voice heard, even if it's just little old you in your little old neighborhood, but it's not little. This is massive because we know that our voice needs to be heard, not just at the polls, but definitely within your respective communities, whether it be in Atlanta, whether it be in Florida, but we know that we're vital, and that's how you can become politically engaged, especially we talk about over the next few months. And I can provide some additional resources as well, Ms. Francis.
Thank you so much. So considering, for instance, you did mention environmental justice,
Mhm.
considering the water crisis that took place in Flint and other industrial spaces around the US in relationship to urban communities, how can we either be proactive in preventing a crisis such as Flint, or if we understand and recognize that there are industries or there are spaces within our or close to our neighborhoods which may negatively impact our environment, how can we advocate for our community in order to reach environmental justice?
Well, the great question. A lot is packed into that question, but we can talk about what we're doing right now. And if you have read The Political Determinants of Health, a prime example of political determinants of health and the outcomes of what policymakers did was in Flint, Michigan, right? Understanding that political work is always there. It's who you select to be your representative in your state, in your local boards, but it's also who you select as your governor, because we need to know that these policymakers are the ones making decisions to place plants, chemical plants, landfills, and these are things we're not aware about. So again, getting engaged, knowing what's happening, going to your local established community, neighborhood community watches, what's going down to City Hall. And I talk about that, and we're unveiling current efforts talking about, rolling out a national health equity alliances and talking about what's occurring in your community. How do you become politically engaged? Not get just, we know from a grassroots level, but meeting the legislators where they need to be met, how to talk their language, how to understand and get not only our voice, but our vote across, along with our message across, right? So there are several things that I think we can talk and elaborate afterward, the next presentation, about how Flint, Michigan is a primary example of what has happened over the years. So it doesn't just start with an election. It starts with historical processes that have been established even before you were born in terms of health outcomes. And I talked about generational health outcomes. And we know that this is tracking, this is what has happened over generations. So we often are told, oh, well, I didn't know about a particular issue. Well, that's again, being engaged, putting your ear to the ground to others that, have a like mind and understanding what's occurring. So those are just some things that I say that we can talk about, because things are happening in your respective communities. We just have to be at the table or even be at the door, but understanding that we're not going to continue to sit back and have another Flint, Michigan occur. We're not going to sit back and have continuous landfills being disproportionately placed in communities of color and having exacerbated maybe asthma rates as it was in New York City and Harlem. So we have to understand that we can be engaged and we can be active. And the ways about doing that is being active and understanding that you can walk and talk at the same time and understand that it is going to be part of that voting process and understanding that you continually need to be heard, even if it's just going to your local entity and your organizations and understanding what's going on in your community.
Thank you, Dr. Standifer. And we do encourage all who are on today's Zoom, please submit your questions in the chat box. If you are so willing, you can also open your mic and turn on your camera and engage with Dr. Standifer if you prefer. So we have a few more questions. So is there a difference between policy and politics?
Yes. So policy, Dr. Akitobi, is the way it's an established requirement. It's established. Often it can come in the form of like a mandate, a law, and a bill. Those are policies. Politics is that action that comes to put it in place. Okay, so we know that we have to be involved on all facets, right? So that's what we're doing. And I talk about, for example, we have an initiative now in Satcher Health Leadership Institute where we're gathering and convening top scholars, academicians, researchers, and advocates all in one place to talk about environmental justice and climate change, what needs to be done, what bill, what policy needs to be established. And we know by going through the politics, the actions, the negotiations, the tables, and the networking that we have to do to actually come from a round table to a bill that's politics, right? And at the end of that, we will have legislation, a bill, hopefully introduced to talk about health disparities and health equity and climate change and vulnerable populations. So hopefully that can answer your question as an example, providing environmental justice, Dr. Akintobi.
Thank you. We have a question from Travi, and Travi notes, and I will paraphrase the question. Travi notes that trust in the voting process has been undermined. So what are your thoughts on that, and how do we overcome that within our families, within our friend groups? How do we overcome the perspective of our vote doesn't count? They're just going to steal the election anyway. Right. They already know who they want to win. How do we overcome those conversations with friends and family?
And I think it's vital in terms of just listening, to individuals talk about the trust, because that's true. It's true, right? We have to listen to those who are saying, okay, I don't know, there's a barrier for me to get beyond what has been done historically, but we have to start somewhere, right? So overcoming the barrier of trust, of understanding that there is a barrier, there's a stigma of my vote won't count, so why do I vote? What's in it for me? Whether it's a lesser of two evils, both parties are not going to work for me. So how do we overcome that? And again, I think it's just vital to understand that those those comments and the feedback that we receive, it's real and it's valid. Because we know that historically, oftentimes those who we put and we vote in place to make some sort of change, it hasn't been kind of productive for the population that we hoped and anticipated that it would be, or even that a politician promised for it to be. So I think when we do, as I mentioned, you being very vocal of who is going to be at the table, who is going to be that policy maker, who is going to be involved in the politicking of your particular community, of your particular perspective. What needs to be at the table when you come and talk about your particular issue? And so I think it's vital that you said, and to me, it's changing. We know that it's changing over time, especially, and they're listening, right? I don't know if many of you heard or saw the DNC this week, but there was a stark change, right? And I listened and watched with baby boomer generation, my parents, and from the days when they were young, they said, wow, this is a stark change from what they even witnessed attending a DNC, but what they even saw on television. Notice that there is a change coming with our social injustice movement that is occurring right now, with the pandemic that's occurring, and with the hopes and dreams and the anticipations that individuals thought would be there, but are not really there as we thought they would be. So it's viable and it's real that we're living through these times, but I think it's worthy to listen, number one. When you talk about what is my thoughts, my thought is to listen and to understand and to then start to engage upon action. What's the action that we can do? So if we need someone at the table, because someone's going to be at the table. I think someone's going to be at the table, whether they're representing your viewpoint or not, someone's going to be at the table. So someone's going to be at the table, and whether you put someone in the table, as I talk about, who is going to talk for you and listen to you and with you, then that is the key that we need to explain. So again, that's my thought. And I think it's very viable, because this is something that I talk with family members often. And thank you for bringing that question, Ms. Leslie, into what we're talking about.
Thank you, Dr. Standover. So our next question. So we have now all gone out. We have voted. The persons that we wanted to be in office are in office. How do we hold them accountable? What do we do to ensure that campaign promises are not exclusively that, which are campaign promises?
Yeah, well, I can't talk solely on voting, and I'm not going to talk, but I think, again, it's up to the respective individual. And to me, as I mentioned in my response previously, to talk about what can solely be done, holding the person accountable. I think there are strong, and I could just talk about, there's strong examples, I think, currently in the administration, or actually in representatives nationally, that work is being done. I think there are several individuals in states in California, in New York, who are just blazing through, historical patriarchal systems, speaking their mind, not hesitant, not afraid, and not, and will not hold back any type of viewpoint if it's not speaking for the constituents of their particular area. And so I think that's what we need to have, again, in your respective communities. And to me, we talk about grassroots movements. We know that it's these movements, they're talking, right? The movements that are occurring, it's a voice, right? For often those who are voiceless or not heard or not brought to the table. And so we need to understand that that is a voice that we need to listen to and actively engage. And so when you have representatives, to me, who are actively engaged with populations that are not often heard of, then I think this is very vital to the political process and policy making.
Thank you. We have one more question, and this question is actually from Miss Yvonne Lewis, who is a community activist and health champion in Flint, Michigan. So Miss Yvonne, I'm gonna ask you to be on mic since you're already on camera, because I don't think I can do your question proper justice. So I'm going to ask you to submit your question to Dr. Standifer.
Thank you, Dr. Standifer. Good afternoon. I appreciate what you said with respect to working to not have happen the same thing
Yes.
as in other communities. So I wonder, you mentioned briefly that the Satcher Health Leadership Institute would be addressing these issues, and of course we know that you're going to champion this thing nationally.
Yes.
But are you planning some collective effort that would allow communities across the nation that have experienced these issues to be engaged in what you're doing?
Yes, we are. And I know we have a few. I know Daniel Dawes, definitely our executive director, has reached out. I don't know if you're familiar, with Daniel, but and also his and the talk, and you're familiar with his book. But we are planning, and we're coordinating a national collaborative effort with communities throughout the nation. And if you'd like to be a part of it, we will stay in contact. So I would love to get your information. Hello.
Absolutely.
Yes.
Yes, would love to have an opportunity to talk with you. So.
Yes, we will. Yeah, because and it's we will not have Flint happen again. And those particular, to me, examples of Flints that we're hearing of, many talks of Flints that are already occurring that haven't been brought to the light, right, as of yet, that are there. We will not let that happen again. And so again, we will address these issues on a national platform. We are in preparing within the context of political determinants of health to create a sustainable platform to not have a Flint, Michigan happen again. And so as I talk about in terms of policy and legislation, and that is being established, that is a plan that we're gathering in terms of roundtable and starting the discussions with congressional members that we know are environmental friendly on both sides of the aisle. And so we know that this is unique. And we're not just talking about one side, but we are talking about both sides of the aisle. And that, and we know that that happens, again, Dr. Akintobi, with politics and networking, because we know we have to have both sides of the aisle just historically knowing that. And so we have to be very strategic and how and knowing where certain institutions sit. We're, here at Morehouse School of Medicine, we're in the South. So we know where we sit in terms of a state that is heavily run by, a party that we understand, okay, well, what's the party, alike? And I think someone talked about, well, what are the particular parties currently, their stands on health outcomes and health disparities and health equity. Well, we need to understand what's occurring now. And I think someone did just post a platform that's being provided by Biden, but we need to understand what's occurring now and what will happen in the future. So I would love to continue to talk to you, Ms. Lewis.
Thank you. Well, we have reached 5:30. Our time goes by so quickly. And as Dr. Standifer noted, Dr. Livingston has placed a link in the chat pod, which details Democratic presidential candidate Joe Biden's health platform or policy position. So Dr. Standifer, as we are preparing and as we are entering into a new political and election season, what is your charge for us moving forward and something that we can share with our families during this time?
Well, I think it's an unprecedented time with everything that is occurring. We know that I'll just talk about things that are evident, and Dr. Akintobi is on this call with our current development of COVID-19 interventions of what's happening now. We're just in a space, in a place where we can develop and at least try to start to work on sustainable interventions and programs that we will not be in another place like this again, if and so something does occur in terms of another pandemic. But we have to understand the historical aspects of why we are seeing the disproportionate rates in communities of color, whether it be urban or rural. What's there? What are the drivers? And what are the health outcomes that we can possibly work through? And how do we prevent them from being exacerbated in other populations in the future? So that is an initiative we're working with on the National Institutes of Health. But then we also need to understand that we need to, again, come together. I'm such an advocate of community-based research, and it's near and dear to my heart because that's where I come from. And there is no other way than understanding, being immersed in what is occurring in your next door neighbor's home, what's in the neighborhood, the street that you live on. We are more common than we think. It doesn't matter your zip code, it doesn't matter your state, and oftentimes it doesn't matter your color. I'll talk about race, but it doesn't matter because we are all in this together. And understanding that we're in this together, and once we kind of have a paradigm shift in our thought processes, our political strategies, then I think we'll understand, okay, we're all in this together. And when we talk about cultural aspects and culturally tailored interventions, we all have to understand that and be open to this, and we'll continue to do that. But I think that is just something I would say, that understanding and being open, and most likely to talk to those who may not have the same perspective as you. And some people may have friends or family members that don't have the same perspective as you, but to just listen and listen and start to say, okay, I can digest that. And then once you have an open conversation of listening, then maybe that will be transferred and they can listen to you. But we have to have those uncomfortable conversations first. And that is what we need to have. So that's my charge to you. And I think Dr. Akintobi talked a little bit about the article on COVID and community engagement by Morehouse School of Medicine. So thank you, Dr. Akintobi. Did you want to talk about that or? Okay.
No, I don't want to have the last word, so I'll let you have the last one after this. Thank you, Dr. Standifer. But those things are important. When I talked and asked you the question about policy versus politics,
Yes.
We have to be able to get our message across in ways that are received
Yes.
by whoever the end user is, right?
Yes.
And that might be someone on either side of the aisle. And those messages and conversations sometimes start under our roof or in our families with people who may feel differently, especially now than us. And to be able to listen, understand, and then as we even engage policymakers locally or on the Hill, we have to consider the audience. So when we think about community engagement, how does my message come across in ways that I want it to? It has to do with understanding the position of who you are talking to. And so we want health equity to be something that leaders on both sides of the aisle can receive. And that speaks to a bit of what you got at, the politics versus the policy. We want the policy, but we want the politics to be something that doesn't look like it's only for Democrats or only for Republicans. Health equity is for all. So if you could say a few closing words on that.
Yes, it definitely it is for all. And I think it's great in knowing that we are that trusted voice, right? We are the trusted voice. That's why we were awarded the Office of Minority Health, the grant. We are the trusted voice. Community understands that, okay, what is Morehouse doing? What are they saying? How are they interacting with the community? And although we may not think that individuals look at us or what we're doing is not worthy, someone is always looking, right? Someone is always trying to understand, well, what's happening? And so being definitely at Morehouse School of Medicine and Satcher Health Leadership, it's offered me an opportunity to definitely continue to push forward community-based research, but understanding that, again, what was just stated so eloquently is that, you know, we have a voice, whether it be a different voice than a baby boomer, whether it be a different voice than a millennial, whether it be a different voice from a Republican, a lawmaker. We have to be there together and continue to have, and I'll just use what Daniel often says, those uncomfortable conversations. We often don't like to have it, right? Because we know, you know, it causes, you know, a distaste, but understanding that, you know, even if we don't like or have traditionally or historically been taught not to like someone because of political party or a race or a gender or a sexual orientation, that we have to be open and engage with that population or that person or that community, or you will not attain, of course, health equity. We know that. And knowing that it's what's equitable and what's achievable is definitely something that needs to be sustainable. So thank you so much.
Thank you, Dr. Standifer, for galvanizing closing words. Thank you so much. And thank you to each of the attendees in today's family meeting. We hope that you have enjoyed the extremely informative and engaging presentation by Dr. Standifer. And as always, we invite you to connect with the Morehouse School of Medicine on your favorite social media platform using the hashtag FamStrong20. Additionally, there are several resources that have been shared in the chat pod, so we encourage you to find that chat pod and to download and to click some of those resources. And on behalf of the Morehouse School of Medicine Prevention Research Center, we thank you for attending part 5 of the FamStrong20 virtual series.